Hi everyone, good morning. Welcome to our MRB radiology recall session. And I'm very happy that only 3 questions came from radiology, and all the 3 questions were repeated many times in our sessions, in our class, as well as in our classes, as well as in our recording sections. So the first question which they asked was, gadolinium containing contrast agents are associated with. Okay, so we all know gadolinium is a contrast agent that is used for MRI imaging. We usually give gadolinium together with the T1 weighted images. All these are known concepts, and the notorious complication which is associated with gadolinium is always NSF, that is nephrogenic systemic fibrosis. Nephrogenic systemic fibrosis. When the patient develops nephrogenic systemic fibrosis is if the patient is having renal compromise, if his renal function test is higher, and if we accidentally administer gadolinium without noticing his RFT, the patient will develop nephrogenic systemic fibrosis. Okay, that is one notorious complication. It is not perihepatic fibrosis, it is not perianal fibrosis or lactic acidosis, it is nephrogenic systemic fibrosis. And we know this has been repeated many times in our sessions, okay, in our MRB classes as well as in our question bank. This notorious complication, we have described it many times, okay. So the answer was nephrogenic systemic fibrosis. Now, another important question, and I'm happy that this same question we had once discussed in our leaderboard also, so about endometriosis, and the question was directly straightforward. What is the ultrasound appearance of endometriosis? So in endometriosis, what happens is you will be able to see a cyst with multiple low level internal echoes. Okay, so we will be having very low level internal echoes. So this is low level internal echoes cystic wall. So that is the answer. See, this is how endometriotic cyst or endometriosis will be seen. It will be a cystic lesion which is filled with homogeneous cores in low internal echoes. That echoes is also called as ground glass echoes. Okay, you can call that as ground glass echoes. So low level internal echoes is the answer. So this was one leaderboard question which came on between the day 11th and 24th as question number 18th. Okay, about endometriosis. And this is finally, actually this is a very simple basic question, a very basic level question that we always say, which hilum is situated above in normally. Okay, so normally we all know left hilum is situated above the right hilum. So the answer for this is 97% of patients have left hilum higher than the right hilum. So this is the correct answer. This is again a very simple concept. Okay, left hilum is above the right hilum because there is eparterial bronchus in the left side. Similarly, left hemidiaphragm, we already discussed in the class. The left hilum is above the right hilum and left diaphragm is situated below the right diaphragm because of the presence of cardiac pulsation. So these are the two physiological and anatomical things resulting in radiographic appearances of left hilum and left diaphragm. So always remember, left hilum is situated above and left diaphragm is situated below in a normal chest radiograph in 95%, 97% of the population. This was another thing that we already discussed in our classes. Okay, so only 3 questions came. One question was regarding gadolinium and nephrogenic systemic fibrosis, a very easy one. Another question is about the classical ultrasound appearance of endometriotic cyst, which is filled with homogeneous low level echoes. And the final one was another basic anatomy as well as radiology related question, that is, what is the normal position of hilum? So in 97% of the population, left hilum will be situated above the right hilum. I hope all of you have done well. All the best for the results. Stay in touch, keep learning. Thank you.